introduce Lisa Tang, who is our first speaker. Lisa is a PhD student and has worked with the Guelph Family Health Study for a number of years, and she's going to present on screen time. And her favorite snack is
yogurt. I mean, like, yogurt's pretty good, to be honest.
So Lisa, whenever you're ready, feel free to present.
Thank you for the introduction. Yogurt is one of my many favorite snacks, so I appreciate you sharing that with the group. And I'm actually really quite excited to be here for the 7th birthday party presentation. The focus of my presentation will be, as you can tell from my slide, screen time. The way it's going to work is I'm just going to start quickly with the recommendations. How much screen time should our kids be viewing? And then I'm going to give you a little bit of an idea about how much screen time Guelph Family Health Study kids are actually getting. And I'm going to end with some tips and tricks based on our research that might help to reduce the screen time of viewing in your own home. I want to start by just also saying when Jess asked me if I could present about screen time in the Guelph Family Health Study kids, the first thing that popped into my head was this quote from a Guelph Family Health Study parent that had me laughing for days. And that's probably because I felt the exact same way when my kids were a little younger about this exact same TV show. So in honor of that parent and all parents who have grown tired of a specific children's television show, I have named this presentation, Please, Anything But the Wiggle, Screen Time Among the Guelph Family Health Study Kids. So before I get into how much screen time our Guelph Family Health Study kids are actually watching, I think it's helpful to have those numbers in context. Canadian Sedentary Behavior Guidelines put out these recommendations for young children, and they split up with different age groups. So for children less than 2 years of age, the recommendation is actually no hours, no screen time per day. And then for children 2 to 4 years of age, less than an hour of screen time per day is recommended. And 5 years and older, up to 2 hours of screen time per day. Now, I do want to note that this is referring to excess screen time. So screen time above and beyond any schooling. Now, the Canadian Pediatric Society noted in a report that about 15% of children are actually meeting those screen time recommendations. So we do have a little ways to go in Canada. So why is too much screen time a concern? I'll start by saying, although some use of screens have been shown to support education in older children, in younger children, exceeding screen time recommendations can actually lead to some negative health and developmental outcomes. So for example, we know that sedentary behavior habits form early and persist over time. We know that there's a strong link between screen time and childhood obesity. And again, I'll say this is excess screen time. It can negatively impact attention span and cognitive development, as well as language delays. And they think this is because there is kind of a one-way conversation happening here. The screen is talking to the child, but other than the occasional Dora response, perhaps, the child isn't getting a whole lot of back and forth. So they're not actually practicing that language as much as they would off of the screen. And that can impact their language development. Now, how much screen time are Guelph Family Health Study kids actually getting? In children under 2 years of age, children are getting around 56 minutes a day of screen time. In children 2 to 4 years, a little under an hour and a half per day is the average among Guelph Family Health Study participants. And for 5 years and up, children are getting about an hour and 45 minutes a day. In general, it looks like Guelph Family Health Study kids older than 5 years are meeting those recommendations. However, kids aged 4 and younger are over the recommended amount of screen time. Now, parents, we didn't forget about you. In case you were curious, parents on average are getting about 2 hours and 15 minutes of screen time per day. So it comes to the next question, which is the biggie. How can we help manage young children's screen time? Parents really are often the gatekeepers of their young children's screen time. And so through Guelph Family Health Study data and your surveys, so thank you for filling those out, we were actually able to come up with some evidence-based tips to help manage your children's screen time in the home. Tip number 1, avoid using screens to control a child's behavior. Kids love screens. Definitely my own love screens. And so this makes it really tempting to take away screen time as a punishment for bad behavior, or promise a little extra tablet or television time as a reward for a job well done. So I myself have definitely done this in my home, not with the Wiggles. With other television shows, I can stand a little bit more. But I will say that our study did show that using screen time as a means of controlling a child's behavior can actually result in a kid wanting to spend a little bit more time on the screen, making them desire it a bit more. If we think about food as a reward, it's kind of similar to that. So just like chocolate and cookies, it can cause them to want it a bit more. And so in the end, over the long term, children tend to watch a bit more screen time when we use it to manage that kind of behavior. The next tip is setting limits around screen use and then keeping track of those limits that you set. It is challenging to set limits around children's screen time, especially if you're implementing these new rules for the first time and perhaps the kids weren't actually expecting you to implement them. So our study does show that it's worth the effort. Setting limits around screen time was actually linked to children spending a little bit less time on the screens. And so likewise, keeping track of how much screen time kids were getting was also linked to children spending less time in front of the screen. The tip is really, if you're going to the effort of creating and implementing these new screen time rules, which take a lot of effort and energy, it is helpful to then take the extra step to monitor how much screen time they're actually getting, because this does show that it helps to reduce their overall screen time. Tip number 3 is don't mix media and meals. Mealtime in my home is one of the main ways we learn about each other's day and share stories. Even during COVID and periods of virtual learning, this has been helpful because I get to hear my children's interpretation of the day. Some days, full disclosure, that interpretation is more accurate than others, absolutely. But if nothing else, it's definitely entertaining. So in our Guelph Family Health Study, children whose parents had television on during meals or allowed screen-based devices at the table actually had a higher screen time than the children whose meals were screen-free. So if possible, not really allowing screens at the table, but that also goes for us as parents as well, which kind of brings me to tip number 4, which is ditch the devices when you're engaging with your kids. We've all heard the phrase monkey see, monkey do. Well, our study showed that this was also true with screen time. I mentioned earlier to the group that I would actually like to change the saying to monkey view, monkey do, but it hasn't caught on yet. I don't feel like I'm getting a lot of support for that, but I think we can have it catch on in our community. So parents' use of screen-based devices when they're with their children was linked to children having a bit more screen time in their day. So when you are with your children, it is helpful. I know it's tempting and very easy, but it is helpful to avoid, when possible, looking at your phone. I do this myself. I catch myself doing it, but it's about being conscious of it and trying our best as well. So avoid using screens while engaging with your kids. I want to also note is kind of a great way to model healthy behavior, but then prioritize face-to-face interaction. So every time I do this, I think to myself, if I prioritize face-to-face interactions, maybe when they're teenagers, they'll prioritize face-to-face interactions with me. But I'm not sure if that's going to happen. So I will let you know on the Guelph Family Health Study 17th birthday party. So that is it for my tips. Thank you.